We know that to be effective in the prevention of drug use, we must address underlying risk and protective factors. And so the question before us is how? How can we help communities mobilize and know that we're making a significant community-level change? Since 1988, we've been testing and refining with community input a prevention framework that helps communities match evidence-based programs to their specific needs. We call this framework Communities That Care. Blair Brooke-Weiss, our Communities That Care specialist, will talk a little bit about the process. Blair?
Kevin, we can hear you, but Blair doesn't seem to be on. I think you should go ahead and proceed.
I'm so sorry about that. CTC communities mobilizing using a 5-phase process to build high-functioning prevention coalitions. They participate together in trainings during each phase. This way, all members learn to apply prevention science principles throughout the process. How does it work? Well, first, the community gets started in Phase 1 with community readiness assessment. Once ready, in Phase 2, key leaders are engaged and a coalition of stakeholders is formed to oversee the process and make sure it's moving along. Phase 3 is all about community assessment, which involves 2 important steps. First, they use data to choose priority risk and protective factors. And second, a community resource assessment identifies any gaps that should be addressed. In Phase 4, based on that assessment, the coalition creates a plan. They select from a menu of tested effective programs that will work for their community. Finally, in Phase 5, communities implement these programs with fidelity, monitor implementation and outcomes, and adjust as needed. So does this change youth outcomes? Well, the evidence would suggest yes. Next slide, please. Since 2003, we've been testing CTC in a randomized community trial in 7 states, 24 towns, with annual data collection. By spring of 2007, youth in the CTC communities had significantly lower rates of initiating drug use and delinquency, lower rates of use, and fewer delinquent and violent behaviors. These benefits were sustained into grade 10. Please continue the slide. Thank you. One more. Over 300 communities in the U.S. are using CTC to combat drug use. One of these is Tooele, Utah. Jacqueline Sagers, director of the CTC effort, will share about their experience.